Trans populations experience disproportionately high rates of sexual victimization, have historically faced discrimination by healthcare providers, and may have unique and diverse needs post-victimization. In Ontario, a quarter of trans people seeking care at a hospital emergency department have been ridiculed, and 1 in 5 trans persons avoided emergency departments because of previous discrimination or fear of experiencing discrimination. A 2017 survey across Ontario's 35 hospital-based violence treatment centres, which provide comprehensive healthcare, psychosocial, medical, and forensic examination services for sexual assault survivors, found that 96% of specially trained forensic nurses strongly agreed that there was a need for training in the care of trans survivors of sexual assault. To address this gap, Women's College Research Institute and the Ontario Network of Sexual Assault and Domestic Violence Treatment Centres, in collaboration with Rainbow Health Ontario, a province-wide program aimed at improving the health of LGBT persons in Ontario, have been developing a novel curriculum for sexual assault nurse examiners in the care of trans persons who have been sexually assaulted. With funding from the Women's Exchange 15K Challenge, a specialized curriculum entitled Providing Trans-Affirming Care for Sexual Assault Survivors was developed. The curriculum drew on skills-based competencies that were adapted from recommendations in the U.S. Department of Justice National Protocol for Sexual Assault Medical Forensic Examinations and endorsed by Forge, a transgender anti-violence advocacy group. The curriculum's 31 competencies were finalized by an advisory group of trans community members and their allies who subsequently aided in the development of the curriculum. The curriculum includes a training manual, training module, and facilitator's guide that includes case studies and interactive discussion components to facilitate learning. The curriculum was successfully piloted and evaluated on November 21, 2018, with 47 nurses during the biannual Sexual Assault Nurse Examiner training for frontline nursing staff. Quantitative data collected from pre- and post-test questionnaires showed that although almost a quarter of participants indicated that they had provided direct clinical care to a trans client in the past, over 70% of participants indicated that they had not undergone any prior training on providing care for trans clients. After the training, participants reported on average a significant increase in their overall perceived level of expertise in trans-affirming post-sexual assault care. Participant scores on competence improved significantly across all domains of the curriculum: initial assessment, medical care, forensic examination, and discharge and referral. Qualitative feedback revealed that participants recognized the significance of this training. One participant indicated, "This training is incredibly relevant and important. This should be available and mandatory for healthcare providers everywhere."